Hello and welcome back to Sunsets in Kuwait. In our series of Learn Kuwaiti, this is podcast number 4, Hospital Setting. Alright, first we need to know what is a hospital.
مستشفى.
Mustashfa. Okay, and that is different than a clinic. A clinic would be
مستوصف.
mustawsaf. They sound similar,
But they're different.
mustashfa and mustawsaf, but they are different.
Yeah, المستوصف usually you go at the beginning you have to go to the clinic مستوصف. بعدين يعطونك تحويل. فالتحويل is a transfer. So you go to the clinic, you take the transfer paper, then you can go to the hospital or مستشفى.
So we're talking about government hospitals.
Yeah.
Because if you go to the private hospital, then you
can
just go.
Also
immediately.
government you can go in if it's an emergency.
Okay, so what would you call an emergency?
طوارئ. So in case of طوارئ, you go to the hospital with no issues because it's حالة طارئة. Yeah, it's an emergency. Yeah.
And now if you have to call the emergency number, which is 112
Yeah.
in Kuwait, they will send you an ambulance. What is it called?
إسعاف. إذا رحت بالإسعاف, if you go with the إسعاف, the ambulance, then you can go تقدر تروح المستشفى. You can go to the hospital إلى الطوارئ, to the emergency.
To the emergency. All right, once you arrived in the hospital, either emergency or
They will
just
ask
a
for the
visit.
file.
Yes.
So يقولوا لك روح جيب الملف. So for the file you will wait 2 hours, 3 hours.
This is typical.
Usually, yeah. بعدين when the ملف comes, the file comes, then you will go to the
First you present your bataka, your civil ID.
تعطيهم البطاقة على أساس يشوفون they will see when ساكن, where do you live. So because every hospital is in a location, so you have to go to that hospital.
Right.
We are talking about government hospitals.
Yes, this is related to government hospitals. If you have an insurance, which we will talk about later, then you go to your providers, right?
Yeah.
Then, okay, so file is...
ملف.
And then there is another one, which is record.
Yeah, سجل.
Sijil. Okay, so your record file will be...
سجل الملف.
Exactly. So you can either use one or the other, or both.
Yeah.
Right? Okay. Now, usually you do that in the reception, right?
الاستقبال. أول ما تدخل المستشفى راح تلقى الاستقبال بوجهك. The first.
You will find the reception in your face.
Yes.
Also, I've heard this word when somebody delivers a baby.
Yeah, it's also receptions.
Yeah, it's literally reception, right?
Yeah.
So whenever you have a wedding reception or a giving birth reception, you will use this word, which is...
استقبال. Usually also they do it on the private hospitals. They make this big room and they do the reception there.
Yes.
So it's easier than doing it in their own home. So they will just deliver and do the reception, الاستقبال في المستشفى وخلاص.
Yes. So people can visit and bring their gifts and everything.
Yeah.
Okay. And then in the reception, they will ask you if you have an appointment. And we have seen this one already.
موعد.
Okay, so they might ask you, is your appointment now? And then you say yes. We encourage you to go to the numbers video so you can practice your numbers in Kuwaiti so that you can answer their question whether what time is your appointment or which day is your appointment. The video on days of the week and months of the year will come soon, but you should know that it's the same as in classic Arabic, right?
Yeah.
Okay.
So موعد would be الموعد اليوم, the appointment is today. الموعد باكر, the appointment is tomorrow. الموعد أمس مثلا.
So
yesterday.
Yesterday, اليوم today, باكر tomorrow. So we're still at the reception, and usually they ask you for the insurance, which is
تأمين.
تأمين.
Yeah, they will tell you on the insurance, على التأمين, on the insurance.
Okay, so you tell them yes or no. If you don't have insurance, then you have to pay cash.
Yeah.
Okay, so what do you call a nurse?
ممرض.
ممرض
وممرضة. male or female. ممرض is a male. ممرضة is female.
alright, and then a doctor.
طبيب male وطبيبة female.
طبيب.
or a doctor or دكتور.
Yeah, usually you hear doctor.
دكتور yeah.
patient.
مريض. أو مريضة. مريض a guy, مريضة is a woman.
So مريض is also sick.
Yeah.
Right?
أنا مريض. لا مو كورونا.
So if you say, if you're referring to a patient, it's basically somebody who's sick.
مريض. شخص مريض.
You can say, you can use the word in two contexts. You can use it to refer as a patient, and you can use it to say I'm sick or fulan or somebody is sick, right? مريض و مريضة. Right. Okay, so the nurse will usually take your weight, which is
الوزن.
وزن. And that's done in the scale, which is
ميزان.
ميزان. And then the height.
طول.
طول.
And usually they say okay ناخذ الوزن أو ناخذ الحرارة.
ناخذ is what?
We take.
We take.
راح ناخذ الحرارة أول أو ناخذ الوزن أو ناخذ الطول.
So ناخذ الوزن. ناخذ الطول. and ناخذ الحرارة.
ونقيس أو نقيس ضغط الدم.
So
the blood pressure.
We measure the blood pressure. How do you say measure?
نقيس.
Usually some people ask for wheelchairs, which are
كرسي متحرك.
كرسي متحرك. متحرك is moving. Coming from the word that we've already seen, which is حركات, right? Movement or action. And the mo at the beginning, it's a continuous, right?
Yes.
So
like دراسة, studying. مدرسة is continuing studying there, so it's مدرسة.
Right.
Or تعليم, معلم, he is a teacher who always, or مدرس, he always
teaching or studying. And then كرسي is chair. And that word you can use for any type of chair. Okay?
أقعد على الكرسي means I sit on the chair.
Yes. Okay, so very pertinent. Gloves.
احنا نقول gloves هم بس قفازات هم ساعات.
So you can say gloves or
قفاز أو
قفاز. Then mask.
كمام.
كمام. And then mask, now we're seeing this type of mask, but we can also call the nebulizer
كمام.
كمام. Okay? So if there's any patient that needs a nebulizer, you can also say كمام.
كمام.
What do you call an inhaler?
بخاخ.
بخاخ. Okay?
يعني ساعات يخيرونك تبين كمام, you want كمام or بخاخ. Or
okay.
Inhaler,
And then the needle or injection?
إبرة.
إبرة. Okay? Do you want to talk about the places where you put the إبرة?
Yeah, إبرة. Usually this place will cause a confusion.
Commotion.
And yeah, it's the بالعضل is in the butt.
On your butt cheeks.
Yeah, so it's called بالعضل. In the muscle, they call it.
In the muscle, but muscle. We have so many muscles.
Yeah, that particular muscle.
So
بالعضل. Yeah, إبرة بالعضل.
If you ask where is the إبرة?
وين راح أخذ الإبرة? Where I will take the injection.
وين راح أخذ I will take the إبرة.
بالعضل, for example.
If you hear that, then you know.
Yeah.
Okay. So, how do you say you have pain?
عوار أو ألم.
عوار.
في عوار?
Do you have pain? Okay. And pain can be in different places, right? So we can have, for example, headache.
عوار بالراس أو صداع.
So a headache would be
صداع.
صداع. Okay. And when you have stomach pain?
ألم في البطن.
Or عوار.
Or عوار في البطن. Yeah.
Okay. So very relevant to this time. If you have a cough.
كحة.
كحة.
مهم.
كحة.
إذا عندك كحة هذه واحدة من العوارض الكورونا. one of the corona signs.
Yes,
الكحة.
or of the symptoms, right?
مهم.
And then diarrhea.
إسهال.
إسهال. إسهال.
مهم. إسهال. عندي إسهال مثلا.
And then vomiting.
vomiting is ترجيع أو تزويع.
ترجيع is like to return.
ترجع اللي ببطنك.
Mhm.
to return what is in your stomach.
Like
so ترجيع is more kind of formal than تزويع. يزوع ويرجع.
so it's like puking in English.
Yeah.
And
تزويع is
vomiting.
puking, vomiting is ترجيع. Yeah.
And then if you're dizzy.
دوخة.
دوخة.
وأنا دايخ يعني
I am dizzy.
مهم.
دايخ. or دايخة.
أو دايخة.
Mhm. So دايخ for men, دايخة for
women.
If you have respiratory problems of any kind.
ضيق نفس أو ضيق تنفس. ضيق is من ضيق. من ضيق is means narrow.
Narrow.
So ضيق نفس like
difficulty in breathing.
Yes.
Okay. And then bleeding.
bleeding نزيف.
Nazif. Now pay attention in this one because some people the za and the
is mixed up.
It's the same.
Yeah. So here نزيف they say أنا أسوي نزف يعني I clean.
أنزف.
or الغرفة نظيفة or أنا أسوي نظيف. لا نظيف is clean. نزيف is bleeding.
So let's try and make sure that we pronounce the letters correctly.
نظيف.
Nazif is to clean and nazif is bleeding.
Yes.
Okay. If you're pregnant, usually the nurses will ask you before any procedure
حامل.
if you're pregnant.
إذا أنت حامل.
Yeah. Or they ask the husband. هي حامل. يعني if
Why do they ask the husband?
I don't know. So yeah.
Then also if you're traveling.
Yes.
Before you travel.
Before you go to the X-ray.
في حمل. They say there is pregnancy or أنت حامل. Or yeah.
And it's very important if they don't ask that you tell them that you're pregnant before you go through any, checkpoint.
By the way, حامل من حمل. حامل is to carry. So are you carrying? This is what they're saying. حامل. أنا حامل الموبايل. Or some people they say أنا حامل للفيروس. I'm carrying the virus.
So carrying.
So حامل is carrying, but is usually حامل for a woman that's pregnant.
She's pregnant. And then with any of those symptoms, you will feel tired, right? How do you say it?
تعبان.
أنا تعبانة. أنت تعبان. Right? For male and for female. If you're diabetic.
مريض سكر.
Literally, you're sick of the sugar.
Yeah, or you're patient of sugar.
Patient of sugar. So you have
or
problems.
Or you're so sweet.
Yeah. So you have problems with the sugar. Okay. And this is a very common one. Allergies.
حساسية.
حساسية. If you want to say I have allergy to, I don't know, penicillin.
إيه أنا عندي حساسية من البنسلين.
Okay.
أنا عندي حساسية من
anything.
So حساسية is حساسية من إحساس أو يتحسس.
Sensitive.
I'm sensitive. This حساسية.
So how do you say sensitive?
حساس.
حساس.
إحساس is feeling. حساس is sensitive to feelings kind of.
Oh.
So حساسية.
So if God forbid there is an accident and you have to call the 112.
طوارئ تقصدين. You mean طوارئ? The emergency?
No, I mean accident.
Yeah. If you had إذا صار لك حادث تكلمين الطوارئ 112. Remember?
To the emergency number.
Yeah. So حادث is accident.
Okay.
حادث is an accident, not necessarily to be in accident with car or any accident.
Any type of accident, yeah. So usually you go to the X-ray room.
غرفة الأشعة.
Okay, and is there anything we have to learn about those words?
غرفة
is room.
Yeah, الأشعة is ray.
Ray.
How
do you say it?
أشعة.
Okay.
And by the way, أشعة الشمس is the
Sun rays.
sun rays. Yeah.
Okay. Shams is the sun, if you didn't know.
Mm-hmm.
Now, if God forbid you have to have a surgery, they will usually tell you have to make عملية.
Mm-hmm. عندك عملية أو لازم تسوي عملية. Yeah, عملية is an operation.
In general.
Yeah, it can be for everything, surgery or operation for army, for example.
I see.
Uh-huh.
So.
Or suicidal operation, عملية انتحارية, for example.
So you can use it literally as operation.
Exactly.
Like there's a plan and somebody will do something.
Yes.
Now, when we talk about surgery in the hospital, certain surgeries have different names that are not necessarily the general term of عملية, right? Like takmim. And this is when they restrict the stomach, for example, when you want to have a smaller stomach, or any other operation that's...
They call it, by the way, عملية تكميم.
Okay.
Yeah, so تكميم from كمام, it's like when you shock the المعدة.
Yes, معدة is stomach.
So تكميم, عملية تكميم المعدة.
So when they restrict the stomach. It's a surgery where they restrict the stomach.
Yeah.
Okay. Then we have the lab. Sometimes you have to make
المختبر.
Analysis, for example. What is that?
تحليل. Analysis is تحليل. Like لازم تسوي تحليل. وين تسوي التحليل? Where do you do the analysis? في المختبر. In the lab.
مختبر. So in the مختبر we make the تحليل.
مختبر من اختبار. Again, اختبار is test. So they do the test. الاختبار في المختبر. Remember مدرسة.
Yes.
مختبر.
The continuous.
Yeah.
The So اختبار is a test. Usually you will hear it in the school setting. And then اختبار.
And then اختبار.
So مختبر is where you perform all the tests.
Exactly.
Continuously.
Exactly.
Okay, and then analysis is again?
تحليل. Analysis as plural is تحاليل. تحليل is one
so analysis as in plural is?
تحاليل.
تحاليل.
Yes, and the singular is تحليل.
تحليل. Okay. And then the last one is where you usually go after you visit the doctor, which is the pharmacy.
الصيدلية.
الصيدلية.
Yeah, where you have to queue and wait for your medicine.
Yes, or you can call.
Yeah.
Yes.
صيدلية.
الصيدلية, okay?
الصيدليات الحين في الوقت الحاضر in this current situation they open 24 hours.
Right.
يفتحون 24 ساعة.
Yes.
24 hours.
And then there are different types of medicine.
دواء is the medicine. الدواء ممكن يكون سائل شراب وممكن يكون حبوب وممكن يكون قطرة.
So دواء is medicine which can be either pills, حبوب, drinkable kind of liquid,
or سائل liquid,
or drops, قطرة. So you have the three different kinds of medicine in general. As usual, if you have questions or if you have comments, please let us know down below. And we want to take a little space here to thank all the workers in the medical field and the first responders for all your support.
شكرا جزيلا على تعاونكم.
Yes, for keeping us safe and helping the government keep us safe, and may God bless you all, and we'll see you next time.
شكرا جزيلا. مع السلامة.
Bye bye.
Bye.